Good morning, everybody. I hope that you all had a great break. My name is Mary Nelson Robertson, and I'm going to be co presenting with my colleague, Dr. David Baez. I'm going to do the first half of the presentation, and then he's going to wrap up the ending of our presentation. And today we're going to talk with you all about farm stress and mental health resources. And this is something that definitely ties into what we've been talking about the past 2 days. And I am curious, maybe if a few of y'all could maybe raise your hands, if y'all have noticed farm stress and mental health being an issue among the farmers that you work with and interact with. Maybe just a few nods of the heads. So how Dr. Baez and I got into this work is we started out with the Promise Initiative, which is an opioid misuse prevention project focused specifically on rural families. But after we got into the project and we were meeting with these rural families, we realized that we really needed to also focus on the ag producer population. And that includes not only the farmer, but also the farmer's family and their employers. And so, employees, excuse me. And so, we started out doing a mental health first aid training and academic detailing. Dr. Baez is going to expand on the trainings that we're offering as well as some resources at the end of the presentation. But just wanted to give you a little background that we got into the farm stress and mental health world through opioid prevention. And as I continue on the presentation, that will all begin to make a little sense. So the opioid crisis, overall national perspective, 2/3 of the drug overdose deaths in 2017 involved an opioid, which is approximately 130 Americans dying every single day from an opioid-related overdose. And so this is something that's really impacting our nation, and it's important that we do something about it. So what are the root causes of farm stress? Most of you work with farmers and you already are familiar with these root causes. So if a machinery breaks down or the livestock get ill, the debt overload, family disagreements, the weather, high interest rates, the crop yields, the market prices, and the government regulations that are currently going on right now are all causes of stress among farmers. And if you notice, a lot of these stressors are out of one's control. The farmer can't control the weather, they can't control the markets. They can try to prevent family disagreements and livestock illness and machinery breakdowns, but those things are still going to happen. And these stressors are out of the farmer's control. And farmers are really strong, committed people. And when all these stressors pile up, it can be really challenging. Because when we think of a farmer, we typically think of a really tough individual, but they're human beings just like all of us. The farmers are also suffering from the prices, like you've heard about the past 2 days. Dairy farmers are really struggling. The milk prices and the corn prices, as you can see on these line graphs here, are steadily decreasing, as are soybeans and upland cotton. The prices are just steadily decreasing, and it's really hard for the farmers to catch up with paying off their debts and whatnot. Another thing that people oftentimes find interesting is this graph that the USDA provides. And the yellow bar is referring to the actual median household income from a farm. The gray is the median household income from together. And if you can see, you notice that the gray makes up for a lot more of the median household income than the yellow does. And a lot of people don't realize that farming is not always enough to provide for one's family. Just the income from farming alone is not typically enough. But it's really important because we need all of these things as human beings to survive. We need milk, we need rice and cotton, and we need chicken, and we need our hogs to eat. And so it's really important to note this. And that puts a lot of stress on the farmers that they may not be contributing enough financially to their families. And if you think about a dairy farmer, That is a 365-day year-round job. You can't take a break from dairy farming. You have to milk your cows at least twice a day, and you can't miss those milkings. It's really important, especially if you want to make ends meet. And so that's really frustrating that a dairy farmer can't even make up their total median household income, and they're working extremely hard through extremely tough weather conditions and financial conditions. Farm stress. So on top of all these stressors, we also know that farming can be very hazardous. It's one of the top 8 most hazardous occupations in the world. In 2016, nearly 420 farmers and farm workers died from a work-related injury, which was approximately 21.4 deaths per 100,000 workers. And every day in the United States, approximately 100 farmers suffer an injury that results in lost work time. And these next 2 statistics are what really hit home, close to home for me. I come from a farming family. My brothers and my dad farm the family farm. They're 8th generation farmers, and it's when I read these 2 statistics, it really hit close to home for me. 3 out of 4 farmers report being directly impacted by opioid misuse. That's 75% of farmers, including their farm workers, reporting being directly impacted by the opioid crisis, which that includes their family members, so their spouse or their child. That also includes them in this statistic. We also know that 3 out of 4 farmers say it would be really easy to access opioids. And this may come as a surprise to most of you, but if you think about rural communities, one thing that rural communities are known for is being close-knit. And we've probably all been guilty of this at some point in our life, but maybe if we call our neighbor or we call our family member down the street, hey, I threw my back out and I can't get to the doctor until Monday, could you spare me a couple of painkillers? And that is definitely considered opioid misuse. And so if you've ever done that, I encourage you to try to break that habit. But I would say that a lot of us have probably been guilty of calling a neighbor or a family member to get us through the weekend with some medication. And another important thing to consider when we're talking about farmers are an extremely unique population. And we often don't think about farmers when we think about mental health. And it's also important when we're deciding how to approach farmers that we understand where the farmer is coming from, or we try our best to understand. And Rossman's Agrarian Imperative does a really good job of explaining this. The Agrarian Imperative suggests that there's a genetically programmed instinct that impels farmers to hang on to their land at all costs. The Agrarian Imperative instills farmers to work incredibly hard to endure unusual pain and hardship and take uncommon risk. Therefore, the land means everything to farmers, and losing the farm is the ultimate loss. As a farmer's daughter, I definitely feel loved, but sometimes I do think my dad loves the land a little bit more than me. I'm not complaining, but the land is very important to my dad. And I think that he's not the only farmer that feels that way. They love their family, but they love their land too. And when you think about debt overload, from an outsider who doesn't have that farm connection, they may think, well, why don't you just sell your land, pay off your debts, and then get a new job and you'll be on to a better life. But it's much more than that. Losing the land is the ultimate loss. And so when we approach the farmers, it's important that we keep that in our mind, that the farm is very important to them. It's also, not only is it their way of life, but it's sentimental, especially if they're a multi-generational farmer, or they may have risked and given up everything to buy that land in the first place. And farmers are going to endure lots of unusual pains and stressors to keep that land. And they're going to take lots of risk to keep their land. And it's important that we try to understand that the best that we can when we're approaching and working with farmers especially in regards to stress and mental health. So what is stress? Stress is how the brain and body respond to any demand. We have that acute stress as well as chronic. Acute are more of those disruptive life events, where chronic are those ongoing challenges. Some signs and symptoms of chronic prolonged stress may include changes in routine, or you may notice that their care of the livestock is declining, or you may notice that their where they keep their tractors at their shop may not be as well kept as it normally is. You may notice trash accumulating, or the tractors just collecting dust after dust after dust, or they may become ill themselves. And another thing that's important to note is that children show signs of stress as well. Oftentimes we may think that, oh, the children don't know what's going on, but really they do sense that stress when their family is under stress. And so when the children show signs of stress, that may also be a sign or symptom that the parents are under a great deal of stress. And so this comes to that relationship between farm stress and opioid misuse. We talked about all those farm stresses, the debt overload, the machinery breakdowns. And if y'all know anything about a tractor, when a tractor breaks down, it's not just a couple $100. We're talking $20,000 to $40,000 to fix the tractor itself, which is more than the car I drive cost. And so farm stress, all these stressors pile up. And then on top of it being the most hazardous occupation, they may get hurt. So say they have all these stressors going on, and then they're changing a disc on their tractor and they accidentally cut 2 of their fingers off. They go to the emergency room and they're more likely going to be prescribed a valid opioid prescription, which they should be. But next thing you know, the days have gone by and their hand is healed and their hand is in no more pain. But next thing you know, it's easier for that farmer to get out of bed and not think as much about his debt and not worry as much about maybe losing the farm or worried that their livestock are ill. And next thing you know, that opioid is treating their emotional pain instead of their physical pain. And that's where opioid misuse becomes a great problem, is when we're using it for a reason other than prescribed. And we no longer need that opioid because we're not in physical pain, but we're in a lot of emotional pain. And we need to teach farmers, and this can be applied to any individual, not just farmers, but how to cope healthy with employ healthy coping strategies with their stressors, and how to better manage their farms and their financial assets to reduce the stress the best that we can. Farmers are resilient, and we need to encourage that resiliency and enhance their resiliency in order to prevent opioid misuse as well as mental health problems. Another thing that's really prevalent among farmers is suicide. Farmers and ranchers have a suicide rate that is on average 3.5 times that of the general population. Access to mental health is very more sporadic in rural communities, and rural populations tend to have lower incomes, and the overall health factors also tend to be lower in rural areas. And so we're also focusing on hoping that if we employ these healthy coping strategies among farmers, if we educate them and build up their confidence in seeking professional help, that this can help reduce the number of suicides, specifically among farmers, because this is something that is not okay and we've got to do something about it. Now I'm going to transition to my colleague, Dr. David Baez. Thank y'all.
Good morning. Thank y'all for letting us do this. It's always good to be able to share some of the work we've been doing and learn from you all as well. So one of the the sort of giant, obvious elephant in the room that we haven't talked about yet is COVID-19 and what that means for our producers. We know, obviously that it's disrupted life for all of us, but it's been uniquely impactful for agricultural producers. And some of the things that have been affected by COVID-19 for producers is the disruption of the supply chain, which of course has exacerbated the financial stress that we've already talked about. It's meant that we had disruption of the supply chain, not just in terms of getting products off off the farm, but getting supplies to the farm. That's been a problem as well, which is, in some cases meant an inability to pay employees and an increased workload for those folks that may not be as used to working, doing the physical labor of being on the farm. So it's been very challenging and problematic um, for our farmers, for agricultural producers. One of the positive impacts of COVID-19 is that it's provided an opportunity to re-examine current agricultural practices. I like that analogy of the frog in water, and so if you put a frog in boiling water, it's going to jump out. But if you put a frog in tepid water and turn the temperature up, it will eventually die from overheating. And what we have probably experienced over the last several decades is we've been the frog in tepid water, and the temperature has been turned up and up and up. COVID-19 has been the boiling water that we've been thrown into, and we've been able to react and maybe realize some of the things that we've been doing haven't been as across society haven't been as ideal as maybe we would like. It's given us a chance to revisit some of our habits and our tendencies and our practices and make some changes. It's also given, COVID-19 has also given us an opportunity to revisit telehealth and given new exposure to telehealth to people who previously hadn't considered use of telehealth services. And that's been a real positive, or we could say a silver lining in this crisis. Folks don't necessarily like to think about COVID-19 as being positive, but we do want to look for those silver linings, and that's certainly one of them. We know, of course, that stressors like this can exacerbate substance use disorder, thoughts of suicide, a sense of despair, and just a sense that things need to change, and that's been the case for COVID-19. So I want to talk a little bit about what we're doing in response to farm stress and as an upstream effort to address opioid misuse. Mary Nelson, Dr. Robertson referenced that we had gotten into this work because of its connection to opioid misuse, and that certainly is the case. We recognized very early on that we needed to address the upstream causes of opioid addiction and substance use disorder. As extension professionals, our job is not to provide clinical care or treatment, but instead to be educators and to help change the system that causes people or that affects people getting into having these adverse outcomes. So mental health first aid was a training that we became aware of that is in fact very, very effective at equipping people to have difficult conversations about mental health. The goals of mental health first aid are first that we decrease mental health stigma or mental illness stigma, that we increase mental health literacy, and that we increase mental health first aiders' knowledge, skills, and confidence to recognize when someone may be experiencing a mental health challenge or a crisis. And then finally, that we increase their likelihood, the likelihood of that mental health first aider to use the action plan to help somebody experiencing new or worsening mental health challenges or crises. And so mental health first aid, actually, just a little bit of history on that, emanates from Australia, and it's now disseminated across 18 different countries. And in the United States, it is managed and accredited by the National Council on Behavioral Health. So MSU Extension is just one provider of mental health first aid in Mississippi, and certainly one of thousands across the country. For those of you that aren't aware of it, and maybe in organizations where you could consider becoming trained or promoting this training, I certainly encourage you to do that. The action plan, the beautiful thing about mental health first aid is it doesn't just stop with, well, here are all these problems in the world. People are depressed, they have substance use disorder, they have anxiety, they have psychosis, they've got a tendency to consider suicide. We don't just stop with that. So what? Now we know that there's these problems. What do we do about it? And mental health first aid equips those that go through the training with this action plan, the ALGE action plan, and it's assess for risk of suicide or harm, listen non-judgmentally, give reassurance and hope, encourage appropriate professional help, and then encourage appropriate self-help strategies. In Mississippi, we've been very fortunate because of the grants that we've received to do this work, and because of the support of our administration to train all of our extension agents in mental health first aid. And it's been very impactful. Why can mental health first aid help? Well, our communities are innovative and resilient in and of themselves, and we do what we need to do often, and we know that our communities and our extension agents in particular are able to step up to the plate and do this is something that they need to do. We already have the tools. Our communities have experience in capacity building, particularly in extension. We know how to build the capacity of the clients we serve. We've not routinely historically done it in the mental health realm, but it's something that we're able to do and to speak to, and certainly MSU is an example. In many other states, extension services are getting into this space because we recognize the effect of all these external forces on our farmers and our ag producers. Mental health first aid is just another tool that we can add to our toolbox to do something about these mental health challenges. And we tend to look out for each other. We care about our communities, and mental health first aid gives us confidence to keep ourselves and our neighbors safe. It certainly can help both individuals being more aware of what's going on inside themselves, as well as be able to spot those challenges that people around them may be facing. So, we know that knowledge is power. We can recognize signs and symptoms of mental health problems and intervene sooner when we are equipped to do that. We don't have to be in line at the funeral home wishing we had spoken up, but we instead can be on the front end having that difficult conversation. The training doesn't mean that the conversations are easier, but we feel more confident to have them. Knowing how mental health problems present or how they show up in people gives us the confidence that we need to speak with our neighbors and friends. I can tell you, as someone who's had conversations when I've had to ask the difficult question, are you thinking about hurting yourself or killing yourself? It's not an easy question to ask, but because of mental health first aid, I can say that I feel competent to do that. I feel like I can do that. Some folks have a mistaken idea that if you ask that difficult question, that it might make a person more likely to attempt suicide. Actually the opposite is true, that oftentimes that question, we often in mental health first aid will refer to it as the question. If you ask the question, that's sometimes the first sense of hope or sign of hope that people have had. So it's important to get this training, feel confident, and be willing to ask the question. And of course, not all questions are around suicide or self-injury. It may be something a little less acute than that, but certainly the training will help you feel competent to ask those difficult questions. We are also working extensively on development of farm management training. We are very proud that our extension agents are trained in mental health first aid, mental health first aid. We are also working to integrate resilience building into the farm management trainings that we do. Recently, we have been funded to do some work that integrates resiliency into our opioid misuse prevention program, that integrates resiliency into our farm management programs. We're working with ag economists that can work upstream with a family and help them know how to better manage their budgets, better prepare for those things that are outside of their control, so that when they do hit, they're not as much in despair. But as part of that work they do, instead of just thinking of it in silos, and we've got our ag economists doing farm management over here, and our kind of bleeding heart public health, mental health people over here doing their thing, we are working to blend these efforts and incorporate resiliency training into our farm management efforts here at MSU. Other resources that you might consider looking at would be your State Department of Mental Health, your State Office of Rural Health, Ted Matthews Farm Counseling in Minnesota. Ted Matthews has been funded by the State Department of Agriculture in Minnesota since the early 90s to work as a licensed clinical psychologist who exclusively does farm management work. We brought him down to Mississippi for a training on our row crop short course. He was extraordinarily well received, has great resources and great videos. Just Google him as someone to get a little more well-versed in what is it about farm stress that we need to know. Fantastic guy. Michigan State has some good resources. And then, of course, the community, rural community toolbox that Christine has talked so much about and that you've heard a lot about already. Great resources there for you to consider. We need to think about the mental health first aid, but we also need to work on these other things around mental health, work upstream of the problem, but informed about what the problem is, mental health problems are and challenges that our clients face. Of course, I'd be remiss if I didn't acknowledge our funders. We are funded by USDA as well as SAMHSA, the Substance Abuse and Mental Health Services Administration. Fantastic folks to help us get this work done and recognize the power and the capacity of cooperative extension as well as the need. And we feel very grateful for their support. Our team here on campus or Mississippi working on this, not just at MSU, but as well as our academic medical center, have a wide range of expertise, and we are proud of the interdisciplinary nature of our team, and certainly encourage any of you who are interested in getting into this work to not take it on alone, but to bring in those that have expertise in different areas to help make a difference in this space. So again, we are so grateful for the time that you have given us to present on this, and we look forward to engaging further about this. If it's helpful for you, you can reach Dr. Robertson or myself by email or telephone. We're both on social media and welcome contact in any of those ways. Thank y'all.
Thank you both to David and Mary Nelson. We actually have a few moments if there are questions for either of you. We've got a couple minutes here. And so please feel free, anyone, to put some questions in the chat, or you can unmute yourself and ask questions of these two presenters.
Hi, it's Lorette Pichano. And I wanted to say thank you for some excellent presentations this morning that are really informative. I think we worked like way back to the mid-1980s on the farm crisis, and just a couple more resources. The Concerned Citizens of Tillery and Wayman Hinson have done some particular work, and we'll try and find a link on the implications of farm stress on especially African-American farm families, which often manifest in a different way, but those needs are very, very important, and also to think about that. And then also connections to the interfaith networks. There is a rural church network with Dave Rusink at, he's over in Texas A&M. And those networks are much weaker than they were back in the mid-1980s, but still they can be another resource. And just also realizing a lot of what we're talking about is a response to the internal stress, when we also have to address the external stress that the farmers are facing. And so that also means the connections, to a long list of farm advocacy organizations that have helped people manage. And so I just want to mention community-based partners in this regard too. But thanks very much, and we're glad to see the work that's going on everywhere.
Thank you all. Any more questions?
I have a question. For the mental health first aid volunteers, who do you recommend to have that kind of training to serve in that role? What kinds of people are?
Yeah, so we trained all of our extension agents, and that has been really fantastic. We've had some remarkable feedback. We did a 6-month follow-up with our agents after they had been trained, and got, in fact, we've just got a paper accepted looking at in which we discussed their feedback from their 6-month follow-up. they found it to be, they have found it to be really helpful. They said, oh yeah, we've been seeing these challenges all along. We just didn't know what to call it. And we had one agent that called us 2 or 3 weeks after he'd had the training, and he said, I had a client at my door at 8 o'clock this morning who came ostensibly to talk about, it was late July, he said he came ostensibly to talk about a pumpkin problem. He said, but he wasn't there to talk about pumpkins. He was there to talk about the distress he feels as a cancer survivor. And he needed someone to listen to his concern about his upcoming visit to the doctor. He said his quote was, "If it had not been for mental health first aid, I wouldn't have known how to navigate that conversation." So I highly encourage any group who has access to ag producers, if it's in our case extension agents, but it could be FSA folks, it could be bankers and lenders, ag lenders, any group like that you can get to a training to participate, who have that access, and you can give them that heightened awareness of what to look for.
And yes, we did train all of our agents, agricultural, FCS, and 4-H. And we did, some of the agents came in kicking and screaming basically, but by the end of the 8-hour training, their facial expressions totally changed, and they realized just how needed it is. And like Dr. Vaz was saying, 15% of our agents within the first 6 months after receiving the training actually used it in a crisis situation. And so 15% may sound small, but that's a lot when we're talking about crisis. There is a per person fee for the training. It's about $25, but through our SAMHSA and USDA funding, we're able to provide that training. We only have about 25 people in extension who are certified to actually provide the training. And we strategically planned that in the 4 regions of our state so that we could cover each region of the state. Anything you would add?
No, that's it. There was resistance, and it is important to get buy-in. That mandate from our extension director was really important. They would not have come if they were just given the option, but they just the positive response after they had been there was overwhelmingly strong.
Definitely.
Just wanted to ask a question to kind of wrap us up maybe in our final minute. Thank you so much to both of you for talking about the way this has been integrated in extension. Obviously, extension agents are extremely, they're so vital for the connection that they have, that direct connection to producers. Thinking about our other folks on our call today who might be from agencies or nonprofits, could you all just speak to how they might be able to, which of the resources that you shared today would be appropriate for other nonprofits and non-extension professionals on our call today?
Well, you won't hear us saying anything but positive stuff about mental health first aid. It's been remarkable for us. I think it's transferable for anyone who has contact with anyone, and that's all of us. I don't want to oversell it and suggest that it's a golden ticket, but wow, has it been really powerful for us. And I think mental health first aid, I would just encourage folks to find a way to access the basic 8-hour training, and then consider getting trained as a trainer. It's a bit pricier to become an certified instructor, but it is well worth the effort. Mary Nelson, what would you add to that?
Definitely. And now the training can be offered virtually, which helps a lot. And with COVID right now, anyone could use this training. We're seeing mental health problems really spike right now with this social, physical distancing, and there's a lot of stress around the pandemic. And so other resources, I encourage you to reach out to your local extension agents and see if they're interested in getting this training to provide it in their counties. We've also partnered with Farm Bureau, and they've been really fantastic. So maybe your state Farm Bureau Federation is another organization to partner with.
Thank you to both of you. And again, all the links will be coming when these presentations are emailed out. The link to Ted Matthews is in the chat right now, the farm counseling. To reiterate what our presenters said, reach out to your local state departments of health and extension. I want to just thank you both again for this very critical and informative presentation. And we're going to transition now into our final discussion of the day, which is a discussion led by Robert and I believe Sam as well. And this is going to be a final discussion on equity, access, and justice in the food system, and particularly with farmers. So with that, Robert, I'm going to pass it over to you.
Thank you, Sarah, and good morning, everyone. I'm Robert Zavala from Tuskegee University, and I'm taking a couple deep breaths because this is a topic that has been a focus of mine for over 30 years, 35 years, I guess. And it's something that could be a whole workshop in and of itself, but I would say that everything that I'm talking about today will basically boil down to some questions I have at the end of the presentation. And I had this presentation all lined up and all the right number of slides, and then I've been listening to the presentations between yesterday and today, and you take a look at my slides, now they're all marked up and all sorts of comments I had to myself about what I was going to say. If we could have the next slide, please. In terms of the overview, these are some of the questions. That is, what are we talking about? Why are we talking about this? And what can be done? And I'd like to say that this topic is really in a good spot because it includes what was done yesterday in terms of the programs that are available to socially disadvantaged farmers and ranchers that Kenya Nicholas brought to us. And then also to this previous presentation by Mary Nelson on stress. And I think for me, a lot of my research, a lot of my classes I teach, the biggest word I can come up with is perspective. What kind of perspective are we looking at? And I was part of a proposal writing team. Tuskegee was invited to participate with the University of Alabama and Auburn University on a grant dealing with mental health and stress. And they were brainstorming, or we were brainstorming about what do we mean by stress? And someone came up with, the trade deal. It's terrible. That's stressful. And I'm not really good at hiding my my expressions. And now that we have Zoom, I think they saw my eyes pop out. And they said, "Well, what are you thinking about?" And I said, "Well, yeah, the trade deal is important, but for the farmers we serve, maybe that's not number one on their list." And they're thinking, okay, well, give us some examples. I said, well, stress might be, can I walk into a USDA service center? Will I be served when I go into that service center? Will my application be accepted? Will the money, if it's approved, will I get it on time or not at the end of the season? These are some of the questions that our farmers look at, and that's stress. Another example might be what Mary Nelson was talking about, how losing the farm is the ultimate loss. Well, as Sam and I talked about yesterday, and Elena talked about with air property, this land that's been in the family that's transferred without the benefit of will, and because in previous years the legal system was not did not help African American landowners. And it brought to mind a case that a coworker of mine came to me to do a workshop on air property at one of her family reunions. And she gave me some background information. And the person that the landowner was had about 150 acres, 3 parcels. He purchased over time in the 1890s, the 1900s, and 1920. And then I went to the courthouse and went to the records and found out that this person was born in 1863. And then I did some more digging with my colleague, and then at the reunion, which they asked me, do you want to eat first? Or and I said, we better eat first because I don't want to get in front of a meal with a family reunion. But I told them, you know, your first landowner was born in 1863. You know what that means in Macon County, Alabama. And they paused and they started nodding. I said, exactly. He was enslaved. And then they had his mother listed. And she was born in, I think it was 1823. And I said, you know what that means? I mean, Alabama was just barely a state when she was born. And then they had her mother's name. Didn't have a date. But there was a good chance that she was born in the 1790s. George Washington was still around. And I said, you know, that is probably or could be your family's Eve. And that from her to that first landowner, your land didn't start with him, it started with her. And now your land is out there and you know, you all have it today. And then to have it as their property puts it at risk. So that's stress, a completely different form of stress, but that's stress that we need to look at as well. So next slide. What are we talking about? We talk about equity and inclusion. We're talking about equity being equal, having a fair share, unbiased, a division of resources. What's out there and what can I get access to? And that's where the inclusion part comes in. That is, are you at the table? Not just at the table, but you get a full serving. Are you involved in preparing the menu? Do you feel empowered so that you can say, wait a second, I get some of that as well. Next slide, please. So why are we talking about this? Now, you know, this first seminar is in the South, so I'm going to be focusing on African American farms. But we can take a look at the 1910 is described as the year where we had the most land in African American land ownership at almost 16 million acres, 196,000 farms. And look where it is today. It is a decline of almost 90%. We can think about the other groups that were mentioned yesterday in terms of what are, you know, who are socially disadvantaged groups. And, you know, we saw that in terms of Native Americans, Latinx, Asian, that their numbers are growing, whereas the number of African American farms are declining. So the question is, for those groups that are growing, do we have the service providers that know what they need to get access to those programs that they should be having access to? And then for the African American farmers, it's why are they declining? Do they have access? And if they don't, why don't they have that? And again, you know, I will, you know, bring up this idea of land because it is so important about to the African American farmer, to the landowner, to the family, and so on. And it's not that air property is inherently bad. It's just that these landowners have been targeted so that their asset of value, that the land itself has basically been stolen. And so what can programs do to help them feel at the table, getting equitable access to those resources? Next slide, please.
Inclusive of policy changes, more discussion around that would be very helpful.
Yes. So, and again, you know, I'm doing a little bit of history here. You know, you can go back from the 60s to the 80s. You know, we've had studies upon studies. One thing, you know, I have to have, you know, handed to USDA is that they really know how to study themselves and have people do some research. But we've had these publications of equal opportunity in farm programs, meaning no. Equal opportunity in federally assisted agricultural programs in Georgia, no. The decline of Black farming in America. Next slide, please. Which then led to the 1990s, where we have probably this idea of, the CRAT report, Civil Rights Action Team, that the Secretary of Agriculture established, that went across the country and looked at how socially disadvantaged farmers and populations were being served by the USDA. And then reports like efforts to achieve equitable treatment of minority farmers. Problems continue to hinder the timely processing of discrimination grants. And this, of course, led ultimately to, next slide, please, Pigford versus Glickman, the Black farmer class action lawsuit against USDA in 1999. And of course, we think about, serving people and what's the cost of serving people? What's the cost of equity? And then we could look at what's the cost of a class action lawsuit, which was about $1.2 billion. And that wasn't, of course, Pigford versus Glickman only served as a template. Next slide, please. So you had Keep Siegel versus Vilsack, the Native American class action lawsuit, which was $760 million. Then you had Garcia versus Vilsack, which was the Hispanic class action, and Love versus Vilsack, which was the women versus the Secretary of Agriculture, which was between 1.23 and 1.33 billion dollars. Sorry. So there is a cost. And then we have this idea that even with programs that small scale, limited resource, socially disadvantaged farmers and ranchers still don't have that access to the resources. Jerry Pinnock likes to say that, Black landowners represent, have 1% of the land, while the majority has 99%. If the majority loses 1%, they still got 98. If the Black landowners lose the 1%, they got nothing. Same thing here with these resources. Getting 1% of resources, not equity. Next question, next slide, please. So the question is, given court settlements to increase access to USDA programs, why don't more socially disadvantaged farmers and ranchers participate in these USDA programs? Next slide. So what does some research say? And I have to say that this is one of my students did some research about participation of African-American farmers in Georgia and came up with some very interesting findings. Next slide, please. That is, we looked at 4 different major USDA programs. We have the Farm Ownership Loan Program and the Operating Loan Program we see here. And then if you look at the bars to the left, the red and blue bars to the left, that is, have you heard of the program? Then the middle bar is, have you applied to the program? And then the third one is, have you been approved for the program? So for the ownership loan, 71% had heard of the ownership loan program, 30% had applied to it, and 55% had received the loan. Whereas in the operating loan program, 77% had heard of it, 62% had applied to it, and 78% had been approved. So, next slide, please. So why didn't some farmers, apply to these programs? Because some of them were fairly successful in getting approved. Well, the number one reason was, I don't think I qualify. Okay, that is, they are self-selecting themselves out. They have a good chance of getting approved, but they are already at the beginning say, I don't qualify. which is related to the second question, I or others have been turned down in the past. And we're not just saying that they've been turned down, but they've been turned down. That is, you know, don't come into my office, you're too late, you don't have what you need, these kinds of things. And then the requirements are too complicated. Now, a good example of this was USDA also has a rural housing loan and grant program. And if you're over 65, you're more eligible for the grant than the loan. And we were visiting with an elderly woman in a rural area, and her house definitely needed some work. And we asked her, why don't you apply for this grant program? And she says, I tried to, but they wouldn't let me. And I said, well, what do you mean? He says, well, I was starting to fill out the application, but it said loan. And I said, well, why didn't you apply for the grant? She says, that's what they gave me. So she didn't apply. So we went to the office and we said, well, why didn't you have her fill out the grant program? And they said, oh, it's the same application. So if it is the same application, then it's not labeled well. And at that point, this is where things get complicated. Next slide, please. Two other programs that we looked at, there we go, was the EQIP program and the Value Added Producer Grant program, which Renee mentioned earlier today. And then we see here that almost 71% had heard of EQIP and 31% had participated. And then for Value Added, only 39% had heard of it and less than 20% had participated. And I think Renee's presentation was really important because, again, it's very difficult, some of these regulations, and the recommendation was that there's somebody that can help people go through the process to fill out these applications. Next slide, please. And then here are some of the reasons for non-participation. And again, highest one, I don't think I qualify. You may, but you're selecting yourselves out. And again, being turned down in the past, and then a big one, requirements are too complicated. Next slide, please. Now, part of this that we wanted to look at was that, okay, we have programs, people, you know, one of the major reasons they don't participate is, well, one, is they haven't heard of them because, you know, 75% have heard of it, that means 25% haven't. And then how can we get this information out to the farmers that, you know, we're working with? And then we asked them, you know, we can see here for the loans, EQIP and Value Added, you know, preferences for group meetings or one-on-one on the farm and so on. And again, referencing the mental health grant that I talked about at the beginning, one of the people from the other universities were saying, well, since there's so few Black farmers, how are we going to be able to reach them? And, you know, it's like, again, my eyeball sort of rolled several ways, but I said, you're thinking of farmers as individuals, okay? But we're not. We think of farmers as part of a community. That is, you know, our farmers are not just, you know, farm operators, but, you know, they're part of a family, but also a major part of, they're part of a church. They're part of a fraternity, a social organization. And that is, we look at it as a community activity and not a farmer activity. And therefore, if you want to, you know, work with, you know, our farmers, you have to approach it in that respect. So next slide, please. So how can we help in terms of assistance? And one thing that's been going on across, you know, yesterday and today are the partnerships that can help address some of the issues, especially issues of access. Equity is a policy issue in many cases that's not decided at the local level, but access certainly is. And Kenya Nicholas did a wonderful job talking about USDA OPPE. And here, I don't have to read this for you, but in terms of the mission of OPPE and serving the underserved communities. Next slide, please. Then within OPPE, we have particular programs, that is the 2501 program and the Beginning Farmer and Rancher Development Program. Now, what's significant here in terms of policy is that for many years, this program has been going year to year. It is annual budgets, which can be very difficult to hold on to good people because they don't know year to year whether your grant's going to be accepted or not. But now they've changed the policy of the program, and by 2023, it will have a annual budget of $50 million divided between the two programs, and it'll be included in successive farm bills. So it gives a little stability to the farm program. And another thing, yesterday in the breakout session in the morning, I was talking to a program person who worked with Native American communities out west, and I asked her had she heard of the 2501 program, and she had not. I said, that's the program you need to look at and see what you can do to apply for it. So hopefully she'll be able to do that. Next slide, please. This is just a brief graphic that shows, again, the 2501 program that was funded last year. Again, and also starting last year, multi-year projects, which initially they were up to 3 years now, and showed the division between the South, Northeast, Central, and West, and then the entities between the 1890s, 62s, and so on. Next slide, please. We also have cooperative extension assistance that can target socially disadvantaged farmers and ranchers. Two of the major ones, of course, are the 1890s. You won't be able to read those very well, but you can see the dots where they are in the Southeast, and you can get these maps at usda.gov. And then the 1994s, which are the Native American land grants with their extensions. And then there's also, of course, the HSIs, Hispanic Serving Institutions, more on the educational part, which were concentrated in California, Arizona, New Mexico, Florida, Texas, Puerto Rico, Virgin Islands, and so on. And then, I have a whole other presentation about equity in terms of support for these institutions, and don't get me started on state matching funds. But, next slide, please. And then, of course, which a lot of our presenters today talked about, non-governmental organizations, community-based organizations. And there's some really, really powerful ones that work, that target particular SDFRs, Federation of Southern Cooperatives, the National Hmong American Farmers Group, Latino Farmers and Ranchers, First Nations. These are all organizations that are able to tap into USDA and get grants and to help support what these organizations do to the people that they represent. So finally, this boils down to our questions. That is, who are those who need to be included? Okay, if you're a service provider, and we looked at who's defined as an FDFR, and who needs to be included. How can I find out? An interesting side story was that we were reaching out to some Hispanic farmers, and with our 2501 program, and we were looking at them, and one of our specialists, Bob Mance, if, this just brings to mind, I'm going to just give you two minutes on this. Since John Lewis died, there's been a picture that shows him standing up to the state troopers before the Edmund Pettus Bridge. And it's the line of the SCLC and SNCC. And you see John Lewis, and right behind John Lewis is a tall young man wearing a hat and high water pants. That's Bob Mance. And Bob Mance worked for our program until he passed away about 10 years ago. And I said, Bob, in the counties that you serve, the ag census says that there are X number of Hispanic farmers. Can you kind of rattle the bushes and see, if you can find them? And if so, have a meeting. And even better, can you take a picture and we can put it in our report? And he said he would do that. And he sent me a note in an envelope. This is no email. And he says, I had a meeting. They really weren't farmers. They were more farm workers working in some of the processing plants. But I had a meeting with them, and here's a picture of them. And they're sitting around in the circle in his front yard, all drinking beer. And I'm thinking, Bob, I'm not going to send this to USDA, but a good job. So, you can start with the ag census, but you can find out where your farmers are going to the church's social meeting place and so on. Second question, what do they need? That is, just because some people say, I need this information or that information, but how do you get in touch with this group? And we talked about this morning. It's not good enough to say, come on by to the office. Because again, as I mentioned, the office may not be the place of best memories. Maybe there's transportation issues, but how can you get out there? And once you're out there, you ask the question, what do you need? Which then leads to the third question, how can I help you? Okay, that is, I am here to help you, but how can I help you? Then that's where you can look at the issues that are most prevalent that might be addressed with mental health issues, financial issues, land issues, air property issues. That is, getting them access to those programs which they need, which they deserve. Now, this is a quick, run through about some of these issues. These are issues that have come across me working with these programs for 35 years. We've been able to process loans for farmers. The first loan of a Black farmer in a county in Alabama. So, and now it's a regular occurrence. That is we as service providers are out there to then close that gap. The gap's still there, it's slowly getting closed, but we're the ones that can help make that gap close a little faster. That sounded like a big sermon. Okay, thank you all, and I'll open it up for discussion. Sam is there. I'll call him my partner in crime. He's going, oh, don't blame me, but
You did a fantastic job, my friend.
So.
And I think we're short on time. I did see one question. It was representing one of your slides. What does other represent on these slides?
I tell you what, since we're slow on time, everyone will get a copy of this presentation, and or they can contact me directly. It's my first initial R, last name ZABAWA at Tuskegee.edu. Very simple.
Type it in the chat box.
Thank you all. And this is actually, in these last sort of 10 minutes or so, a chance to ask either Robert or anyone today of whose presentation, or even yesterday, this is our last chance to chat with each other. So this is the time for questions. You can unmute yourself and ask. You can type it in the chat. You can also drop in resources. Maybe there's something today from the session that you have a resource on, that you're the expert in the room, and we'd like to hear your voice. So this is an opportunity to share that as well in these next few minutes.
Thank you, Sarah, and please continue to put in those questions and any other resources. We know, like Sarah said, we do have experts in the room and in the audience, and that you as a participant, if you've got resources, just pop those into the chat and share, because we know that you've got those partners and those other entities and resource and services that are available for you. So as Catherine said, there would be an evaluation. We do want to hear from you. You just know that this is in essence a pilot for us. This group has been working for months, and that this is an adaptation on our own part as we go virtual, right? And that we would love to be in the hallways with you, talking further and sharing live resources, right? But we will be continuing to deliver and improve, and we will be moving across the country with this workshop. So spread the word, and please give us feedback. It's just really important for us. The links, the attendee list will all be there, and just the office hours. I mean, it's going to be very open forum. We do not have a set agenda. We may have one opening slide, and it will be just your time to ask further questions that may be very specific to a funding resource or a provider, or just any kind of subject expertise. We're going to have members of the work group and others available. It is a Zoom link, so in essence we would be face to face, and it is scheduled for that time. And just check that Catherine's website. I'm going to check. Yep, and then the office hours, everything else is available. Catherine sent it up again and put it in the chat.
And just to reiterate, a little bit more about what those office hours are, we wanted to give you a few days to let things sink in of what you've heard, and really just maybe as you start to get back in, roll up your sleeves and go back to your regular jobs, another question might hit you, or maybe you want to have another opportunity to chat with us or meet some other folks who are doing this work and thinking about these topics. So that's a little bit about what the spirit of that office hour is next Monday. Again, following that same link that was just shared, you can pop back on and see almost all the same smiling facilitator faces that you saw today. We're happy to answer questions, as Christine said, in a very free format. It's just a visiting time, and you might also get to meet others who are just like yourselves, providing technical assistance. Please also come if you want to share a resource. Maybe you could just sit with us and we'll just visit for that hour, or just pop in for any time that you have during that schedule. The other way that you can be in contact with us and give us your feedback is through the evaluation, so we really welcome that. As Christine also mentioned, this was a pilot for us. This is our first time putting together this material. It was intended to be an in-person session hosted in the southern region. So we went virtual, and we thank you all for just sort of being with us and experimenting with us. We thank you for your time, and we would greatly appreciate your feedback, as we do hope to potentially either do this in person at some point in the future in other regions, and at least virtually in the other USDA regions of the West, the North Central, and the Northeast. So that's our intention. I'll just open it back up to any of my other colleagues to say any other final words right now. And otherwise, we thank you so very much for your time today. And we have very much appreciated being with you all.